The United States spends nearly $5 trillion on healthcare, a sixth of our total economy, and much more than any other nation, yet we are still not healthy. Is medical care not having an impact, or are we just doing it wrong? Medical care treats illness and injury, but lack of medical care does not cause illness and injury. We talk of accessing health, paying for health, getting health, ensuring health. When we mean accessing health care, paying for health care, getting health care, and ensuring health care, our language limits understanding. Surveys have asked people in the US and 7 other countries to rank these 10 factors that impact health from the most important to least. How would you rank them? What would be the most important and the least when it comes to your health? People in 7 of the 10 nations, including the US, ranked healthcare first, and all ranked politics last. Only China ranked income and wealth and education more important than healthcare. When we looked at how Americans rank these factors, healthcare and politics are far from the reality of their actual impact as they could be. I became a medical doctor believing that it was the most worthwhile vocation possible. I also experienced both the benefits of medical care and the harm it could inflict. In 1958, when I was 15, I had a patch of acne below my right ear. My mother took me to a dermatologist who did weekly radiation treatments to that part of my face. It worked and I was delighted. 17 years later, a lump appeared that turned out to be a lymph gland cancer, a result of the acne treatment that I have been battling ever since. But I'm still alive at 82. Medical care can help, but it can also do harm. That is why doctors take the Hippocratic Oath, primum non nocere, or first do no harm. We will talk more on medical harm in another video. Medical care treats mostly cells and organs in the body. We take aspirin to treat platelets, statins to treat liver cells, antidepressants to treat neurons in your brain, and drugs like Viagra to, If you have a heart attack, it's usually caused by a blockage in an artery feeding the heart muscle. And a cardiologist can thread a router device into the artery to open up the flow. This time, medical care treats a specific organ. If an unhoused person came into my emergency department complaining of being weak and dizzy, I had to decide if hospital admission was necessary. I could spend thousands of dollars on tests and typically couldn't justify admission and had to prescribe something they couldn't afford. If medical care treated the whole person, our healthcare system would find them a home, companions, and meaningful work. Research from Stanford Medical School, my alma mater, reviewed different estimates on the effectiveness of U.S. medical care in keeping people alive. At best, it could only avert 10% of deaths. That left 90% impacted by other factors, like income inequality and social factors we've already discussed. The Commonwealth Fund compares healthcare performance among rich countries and ranks the U.S. last, despite spending the most. Other scientific studies show the U.S. performing nowhere near the top. Healthcare has serious limits to its effects on life expectancy. Abandoning the idea that medical care is the key to a long life won't be easy, considering we've been told this all our lives. Please like and subscribe to Healing America channel. In our next episode, we will explore preventive medicine.